Good morning, esteemed guests, dignitaries, and Ayush stakeholders. A warm welcome to all of you to the 5th Sensitization Programme for Empanelment of Ayush Hospitals for Insurance Coverage, an initiative by Ministry of Ayush to promote accessible and affordable Ayush healthcare for all. I am Dr. Kaushiki Krishna, third year PGT NIH. Welcome you all. It is an honor to host this gathering at National Institute of Homeopathy, Kolkata, where policymakers, healthcare professionals, and industry experts have come together with a shared vision to strengthen the presence of Ayush healthcare in insurance frameworks and empower hospital to serve better. As we begin, we seek divine blessings through ceremonial Deep Prajwalan and garlanding of our master, Dr. Samuel Hahnemann and Bhagwan Dhanvantri. I would like to invite our dignitaries for Deep Prajwalan. Now I would like to request our esteemed guest, Ms. Kasturi Sen Gupta ma'am, Chief Guest General Manager at NIC, to join the dais. Ms. Kiran Sahadev, our guest of honor, Insurance Ombudsman, OIO Kolkata, to join the dais. Mr. Inderjeet Singh, guest of honor, Secretary General, General Insurance Council, to join the dais. Dr. Kaustuba Upadhyay, Advisor, Ayurveda, Ministry of Ayush, Government of India, to join the dais. Dr. Sangeeta Duggal, Joint Director, Ayush at Central Government Health Scheme, Government of India, to join the dais. Professor Baijan Kumar Mishra, Chairman of Core Group of Experts constituted by Ministry of Ayush, Government of India, to join the dais. I request Dr. A. Raghu, Deputy Director General of Ayush at Directorate General of Health Services, Ministry of Health and Family Welfare, to join the dais. I request Dr. Mukul Patel, Member of Core Group of Experts for Insurance, to join the dais. I request Dr. Subhas Kaushik, Director General, Central Council of Research in Homeopathy, Ministry of Ayush, Government of India, to join the dais. I request Dr. Pralay Sharma Sir, DYMS, SAG and IH, to join the dais. Thank you, sir and ma'am. Now we'll begin with Dhanvantri Vandana by Shriya Mandal.
शतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवम् ॐ शान्ति शान्ति शान्तिः।
Thank you, Shriya. Now it is time for special moment of gratitude and respect. We would like to felicitate our guests with flower bouquet, uttaryo, memento, and a token of honor which represents our culture of our state of West Bengal. I would like to call Dr. Kaustubh Upadhyay to felicitate Ms. Kasturi Sen Gupta, Chief Guest, General Manager, National Insurance Co. Limited. Thank you, sir. Thank you, ma'am. Now I would like to request Professor Bejan Kumar Mishra to felicitate Ms. Kiran Sahadev, our guest of honor, Insurance Ombudsman, OIO, Kolkata. Thank you, sir. Thank you, ma'am. Now I would like to request Dr. Sangeeta Duggal, ma'am, to felicitate Mr. Inderjeet Singh, guest of honor, Secretary General, General Insurance Council. Now I would like to request Dr. Kaustubh Upadhyay to felicitate Dr. Sangeeta Duggal, ma'am, Advisor, Ministry of Ayush, Government of India. Now I would like to request Dr. Pralay Sharma, sir, to felicitate Dr. Kaustubh Upadhyay, Advisor Ayurveda, Ministry of Ayush, Government of India. Now I would like to request Dr. A. Raghu to felicitate Professor Baijan Kumar Mishra, Chairman of Core Group of Experts constituted by Ministry of Ayush, Government of India. Now I would like to request Dr. Pralay Sharma sir to felicitate Dr. A. Raghu, Deputy Director General of Ayush at Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India. Now I would like to request Professor Baijan Kumar Mishra to felicitate Dr. Mukul Patel, member of Core Group of Experts for Insurance. Now I would like to request Dr. Kaustubh Upadhyay to felicitate Dr. Subhas Kaushik, Director General, CCRH, Ministry of Ayush, Government of India. Now I would like to request Dr. Sangeeta Dugal ma'am to felicitate Dr. Pralay Sharma sir, DYMS, SAG, NIH. Now I would like to request Dr. Pralay Sharma sir to felicitate Dr. Khalid Kaiser, Joint Secretary of Ayush, Government of West Bengal. Now I request Professor Baijan Kumar Mishra to felicitate Dr. Narayan Gangadhar Shahane, Member Core Group of Experts for Insurance. Now I request Dr. Kaustubh Upadhyay to felicitate Vaidya Debashis Panda, Joint Advisor, Ayurveda, Ministry of Ayush, Government of India. Now I request Ms. Kasturi Sen Gupta to felicitate Mr. Rajeshwar Gangula, DGM Health, IRDAI. Please give a round of applause. I request Professor Baijan Kumar Mishra to felicitate Mr. Hari Prasad C, Health Information System and Research Manager. I request Dr. Sangeeta Duggal to felicitate Dr. Austin Jose, DYMS, NIH, Kolkata. I request again Dr. Sangeeta Duggal ma'am to felicitate Professor Dr. Avijit Shi Barman sir, HOD, Department of Forensic Medicine and Toxicology. Okay. Sir, since sir is unavailable, now I'd request Dr. Pralay Sharma sir to felicitate Vaidya Kusum Thapa, Research Officer, Ayurveda, Ministry of Ayush, Government of India. Today's program has been carefully designed to achieve 4 key objectives: facilitating empanelment, promoting affordable healthcare, fostering networking, and capacity building. Through insightful sessions and discussions, we aim to streamline the process of bringing Ayush hospitals under insurance coverage, especially for the states of West Bengal, Odisha, Jharkhand, and Chhattisgarh. As we witness a growing demand for Ayush treatments, it is crucial to align our healthcare systems with modern insurance frameworks. This program will serve as a bridge between policy and practice, helping hospitals navigate the path towards empanelment and ensuring financial protection for patients seeking Ayush care. Now I would request Dr. Pralay Sharma sir to extend a warm welcome and set the stage for today's discussion.
হ্যালো হ্যালো এটা কর্ডলেসটা দেবে respected dignitaries, sound বাড়াবে, esteemed guests, faculty members, dear doctors, the online participants who are watching from across the country, the participants from West Bengal, Odisha, Chhattisgarh and Jharkhand. A very warm welcome to all of you. And it is truly an honor for me to stand before you to address the welcome address in a sensitization program of Ayush system, where we want the Ayush system should be under the coverage of the insurance. This event makes a significant step in our collective journey towards making Ayush system more accessible and inclusive through insurance coverage. What I like to say is this conference is not just a gathering, but it is a call to action. By this conference, we will go one step ahead in the milestone of the coverage of insurance system in our Ayush system of medicine. I encourage every participant to actively engage in the discussion, share their perspectives, and take back a valuable insights, and that can be implemented at the instrumental at our institution, in our hospital, in our education institution, etc. Today we are not just talking about the Ayush insurance, we are taking a step towards making it in its reality. At the outset, I extend my heartfelt gratitude to our esteemed dignitaries and resource person for gracing this occasion. Your presence enriches the event and strengthens the bond between the different streams of Ayush. Your dedication and leadership in the field serves as an inspiration for all of us. We have with us Madam Sangeeta Duggal, Madam, who has been always an inspiration to our institution. Her dedication, her leadership to uphold the homeopathy system of medicine as well as the National Institute of Homeopathy is commendable. I would like to thank Madam for being with us today. Thank you so much, Madam. We have with us Dr. Subhas Kaushik, sir. He is the Director General of Central Research Council of Homeopathy. Sir, under your leadership, as we have seen that many of the scholars who really wants to do research, and you have taken them, and under your leadership, the research activity across the country is gradually improving. That what we can notice. And as research is a backbone for the survival of any system of medicine, and that needs to be encouraged always. And we find that under his leadership, more and more scholar students are taking part in the research activity. Thank you so much, sir, for coming with us, for joining this occasion. We have with us Kosturi Madam, our chief guest today. Madam, in the morning session, she went to the hospital. She has seen our hospital. And what we could feel by seeing her face, that she felt like this is an amazing hospital, what we have in National Institute of Homeopathy. Today itself, we have crossed 3,000 patients by this time of 11:35. Madam and sir, for your information for the audience, what I like to say, our hospital that sometime it touches and it crosses 4,000 patients in a day. And people from not only from the West Bengal, but the neighboring states also joins here. We get patients from Bangladesh, Nepal, Bhutan, as well as from Odisha, Jharkhand, Chhattisgarh, and the neighboring states also joins in our institution. We open the counter at middle of the night at 12 o'clock for the better patient care services. I feel that we have already gone one step ahead with the Ayush insurance because what Madam has seen today, and she was talking with us. We are very hopeful that Madam will definitely will grace us with the insurance coverage. Thank you, Madam, once again for coming here. We have with us Bijan sir, Bijan Misra sir. Since yesterday morning, yesterday evening, he is with us. And we have seen the courage what he has. He has been always an instrumental, an inspiration for the students what we believe. Sir, your leadership has encouraged the academic activity. Your leadership has increased the research activity. And I would like to, from National Institute of Homeopathy, we would like to thank that you have joined with us. We have with us the Mukul sir. Sir, thank you so much. You are academician. Please bless our students who have joined here. Please bless our ex-students too, those who have joined today out here, that we can, in the academic line and also in the research perspective, we can prosper in life. Thank you, sir, Mukul sir, for joining with us. We have Indrajit sir. Thank you so much, sir, for joining this platform today. And we are very hopeful to you that you will do something for the insurance coverage of the Ayush system of medicine. We do have Raghu sir, Dr. Raghu sir. And as you know this, for the policy making of the Ayush system of medicine, he is the pioneer person, what we have understood. And under his leadership, we want to improve the Ayush system of medicine, and we want to prove that this Ayush system of medicine of different streams of Ayush system of medicine can work together under your leadership. Thank you, Raghu sir, for being with us. We do have with us Kiran madam. Thank you, madam, for joining this program today. उपाध्याय सर, आपको बहुत बहुत शुक्रिया हमारा ये and since yesterday evening he has been inspiration. He was coming here and was saying how to improve the this gathering today, this conference today. At the conclusion, what I like to say is that let us work together for the improvement of the Ayush system of medicine. Let us work in the collaborative way. The all streams of Ayush system of medicine should come together and to uphold the status of Ayush system of medicine. Let us hope for a future. In upcoming days, let us understand, let us hope that Ayush system of medicine remains not only as a system of medicine, but it is a system of medicine which covers the insurance so that the patient across the country can get a better method of treatment. Once again, I would like to thank all dignitaries, all guests, all participants, all faculty members, all staff, and the person and the delegates who are watching online. I would like to thank all of them. And with these few words, I would like to conclude. Thank you so much. Jai Hind.
Thank you, sir, for your kind words and for welcoming us to this significant gathering. Now, I kindly request our dignitaries on dais to join us in the front row seat for better visibility of screen. Next, to give us a deeper understanding of National Institute of Homeopathy and its contribution to healthcare, we invite Dr. Austin Jose Sir, DYMS NIH, to share an overview of the Institute's functions and hospital services.
Good morning, everyone. On behalf of NIH and this hospital, I welcome you all, the chief guests and the dignitaries and delegates from online and offline. National Institute of Homeopathy, we have two branches. One is at Kolkata, the headquarters in G block, and the other satellite campus is at Narela in New Delhi. The vision of NIH is to aspire to the India's most energetic and responsive organization to give an unparalleled education opportunities in homeopathy for the learning community to produce highest undergraduate or postgraduate and to serve the nation with contributing to the human citizens. The mission is to have the homeopathic medical education and research and to disseminate their knowledge through their service. The objectives of NIH are to develop the system of homeopathy, to produce postgraduate and undergraduates, and to make researches on various aspects of homeopathy, and to assist in providing services for facilities of research, evaluation, and to make or conduct experiments and develop patterns of teaching in homeopathic education. So this is the journey of NIH. In 1975, Dr. Karan Singh, the then Union Minister of Health and Family Welfare, has inaugurated this institute in 10th December 1975 at the Amar Street of Kolkata. This is the old building which you can see now. So NIH is spread in 3 campuses, one at G block where we are now, it is of 16 acres, and JC block which is of 10 acres for residential complex, and at Kalyani which is 63 kilometers away from here for 25 acres for the herbal garden. And we have a satellite institute at New Delhi at 10 acres. So what we are seeing here is the campus of NIH. This is the academic building. The other one is the hospital building. This is the herbal garden which we are having at Kalyani. We are having a well good equipped basketball, volleyball and a playground for the facilities of the staff and the students. Earlier this institute was affiliated under the University of Kolkata. Later on it is under the West Bengal University of the Health Science. So this is our undergraduate student intake capacity, around 126. Through NEET, we are having 86 students and others. And from BEAMSTEC, 6 students, and WHO sponsored, we are having 10 students. In postgraduate, we are having 47 capacity, 37 through the All India exam of NEET, and BEAMSTEC and WHO sponsored is 4. So we have a very good equipped laboratories, especially for physiology, pathology, microbiology, and pharmacy. It's a world-class infrastructure laboratories we are having. And we have the departmental museums in Aruna Medicine and Repertory and Materia Medica. The library is spread in the 2,700 square meters in a single floor of this building. We have a large books and the old books are also available in this institute for education purpose. This is the seminar hall where we are conducting our seminars and other activities. And the hospital which we are having is the NABH accredited. It is accredited since February 2019 and still now we are under NABH. So if you see that we are having around 12 OPDs in National Institute of Homeopathy and one cancer OPD which is running on Tuesdays and Thursdays, and other we have 10 peripheral OPDs in and around the West Bengal. Our indoor patient, we are having around 100 beds with this bifurcation for male and female wards. So as we have seen the patient care, we are having a huge number of patients. The patients are coming here at the midnight, previous day also. In the midnight, we are giving the token for the facility of the patient to have a easy registration. And this is the picture we are seeing. Even yesterday also, we had a huge number of patients in the midnight. For the facility of the patient, the midnight we start the registration. So IPD patients. So if you see the statistics of the OPD, we are having an increase of around, in last 4 years, a 50% jump is there in the increase of the patient. You can see 3,19,000 was there in 2019-20. In 23-24, we are seeing around 4,78,000. It is around a 50% jump in the patients. There we can see that how the craze or how we are attracting the people to this institute in giving the homeopathy. And again, we can see that we break our own records every time. So we have a highest patient of 3,494 on 7/3/24. And in last 2-3 days, we are again breaking our third highest records of 3,306, 3,251, 3,000. These are the patients we are treating, and we are dispersing the patients even before 6:45 p.m. All patients are getting the right medicines. So IPD, we are having the admissions, and we can see that many incurable diseases, even for palliative care, and there are some diseases which is not been able to treated in other system of medicine. They come over here and get treatment. So if you see from the feedback of the patients who are discharged from this IPD, because we are under NABH, we get a quality care. So the record says that we are giving a very good service. Around 97.5% we are giving a very good service. Only a few of 2 to 3% is coming under the average. Bad is very less. So this you can see from 19 to 21. This is from 22 for the year of 22. Again, we are having the same track record of 97%. Again, in 23, we are having the same track of 97% in 24 also. So we are having a very equipped and we are giving a good satisfaction to the patient in the IPD services. So you can see here, we are giving 2 tokens for the patients to ensure that they are getting the right prescription. Because most of the patients are illiterate, so we have the color coding system here. So according to the color coding, they take get the medicines for, and we are early dispersal also. And 2 tokens are given for them, one with the patient and one with the ticket, so that we ensure that the patient gets the right medicine. Some MOUs are signed between our premier institutes, like with Hind Labs under Ministry of Health and Family Welfare, we are getting the service for the laboratory So they are giving us some discounts and at a very subsidized cost. And we are also getting a revenue from them. So this is their laboratory setup in our institute. So we have a patient gets a very good, well-equipped ambulance service for referral system. And if you say about the cancer patients, this is our picture from 21 onwards. We are having a gradual increase of the patients who are coming over here and getting the treatment and as a follow-up also. So day by day, we are having an increase and support from the patients. So something if I say about the cancer, what is our inference is that in homeopathy, we treat as an individualized treatment approach using the classical method for cancer. And this process begins with the thorough case taking, followed by careful analysis and evaluation of the symptoms. National Institute of Homeopathy follows the current protocols recommended by the modern medicine for screening and diagnosis of the cancer. In the case of cancer, homeopathy treatment can enhance the quality of life, alleviate the patient's suffering, and extend the survival time, and in some cases lead to complete disappearance of the symptoms, tumors, or the lesions. An integrated approach to treatment can provide a powerful combination in the fight against the cancer. And homeopathy as a medical science uses modern diagnostic tools for cancer, including CT scan, MRI, endoscopy, colonoscopy, PET-CT, FNAC, biopsy. All these we are adapting in treatment of the cancer. So keeping this in side by side, we are having in vitro and in vivo studies have been conducted to evaluate the effectiveness of homeopathic medicine in treatment of cancer with various premier institutes. Such one is with the NIPER Kolkata. We have done some anti-cancer remedy, and you see the inference, it is in cost affordability and most effective treatment of cancer and accessible to all socioeconomic categories of the patients. So data from which NIH is treating, it infers that the breast cancer is the topmost, which underwent more treatments than, along with the following as lung cancer, tongue cancer, colon cancer, rectal cancer, gallbladder, stomach cancer, larynx, non-Hodgkin's, etc. So we are providing both treatment as well as palliative care. So integrating allopathic and Ayush systems for cancer care and management can be highly beneficial to the patients, which we have seen. We have seen positive results in patients who received homeopathic treatment following surgery and chemotherapy also. The homeopathic treatment contributes to improving the quality of life of patients, alleviating the distressing symptoms like pain, cough, bleeding, vomiting, anorexia, depression, etc., even for the after effects of the chemotherapy also. So some MOUs we are having with IIT Kharagpur for basic collaborative research works, and we have MOU with the Shyam Prasad Mukherjee Port Hospital for OPD services on every Tuesdays. We have an MOU with the ICAR Atari for giving some services to the farmers. And Ganga Sagar Mela, as we see the Kumbh Mela, here also in West Bengal we have the Ganga Sagar Mela, and we provide our service every year. And during the COVID also, we have provided arsenic help to most of the government institutes and to the residential areas also. We went to door campaign. And being as a premier institute in homeopathy, we do capacity building and training. We give CME programs, ROTP programs. We give induction training for CGHS doctors and for the awareness for the general public also. Earlier in 2010, we have started our telehomeopathy for the Tripura as a pilot project, and we consulted West District of Tripura from NIH. And we have received the e-health award for Ministry of IT in 5th August 2011. So even during COVID also, NIH has given the telehomeopathy service to the entire India. And NIH is designated as the Intermediate Pharmacovigilance Center, and under which we are having 16 peripheral pharmacovigilance. So these are our publications. This is our NIH Delhi campus at Narela, which is a world-class infrastructure. And we have the PG courses there in 7 seats with 7 students each. There also we are having around more than 500 patients per day in a short period. Some research works is going on, like COVID publications we had. Like with NIPER we had preparation of Konduranga potency for inflammatory bowel disease and COVID publications. These are some publications you can see against COVID, and other publications of in silico and in vitro studies. These are all published from NIH faculties. So our strength is our patients, our students and the faculty and the staff. So our achievements, from a single course of deep NIH has gone towards to undergraduate course and to the postgraduate course. And from one institute from Calcutta, it has gone to a satellite institute in Narela, New Delhi. So our target is to be a global leader in homeopathic education, healthcare and research. So thank you all for your patience listening.